So, I think you introduced me pretty well. And I'm excited to be on here today. And so I don't know that I'm going to say anything else about me other than this is fun. So, okay.
Can we,
So I,
can we, can we see your socks? You gotta show your socks every time.
well, I totally failed. It was later. I was like, I didn't even put on heart socks. So I have socks and I'll show them to you. But like, I totally have Valentine socks, and like, I think somebody gave them to me. But when
Probably
I
your wife.
No, actually, it wasn't her that gave them to me. But I have these heart socks that are great. But you're not going to see those today. Today they are bicycles. I don't know if you can see them,
Yeah.
but anyway, it's these are my bicycle socks at the moment. So, and that might be because I love bicycles. I don't know if you can actually see the guy riding on the bike right there.
Yeah.
Uh, so yeah, I love riding my bike, and so my Valentine's Day, I guess my perfect Valentine's Day would be me and my wife out riding bicycles, right? Um, so Tammy doesn't ask to see my socks, so I guess
No, you give me. I want to see your socks.
right. Okay, so I've been thinking a lot about what I wanted to share with you guys. Obviously, I love the questions, and if this is going to go a full hour, we need the questions. But been thinking a lot about what I wanted to share today, and I talked a little bit about this, I think, last time, but I'm always trying to figure out how best to explain. And I heard a phrase recently, that when we are working in a relationship, and I mean any relationship, it can be uh, to spouses, it can be friend to friend. And I know that in a relationship where there's addiction, like, and where there's trauma or betrayal trauma specifically, right, that this is going to be much harder to do. So please understand that I understand the difficulty of what I'm about to share, but it was the concept I wanted to share is making generous assumptions. And making a generous assumption, as simple as it may sound, is I got on to the webinar and it's 2:30, 2:29, and I'm like, oh shoot, like, did I do something wrong? Is Scott, like, does he hate me, right? Like, my mind could fill up with all sorts of things, right? And I remember one time I was like, no, if I remember right, he has to finish another webinar and then get on to mine. And so my generous assumption, as simple as it would be in this case, is no, Scott loves me. We have fun working together. And he's probably super busy and whatever, right? We need to make generous assumptions that the person that we are connecting with or relying on is doing the best that they can. Now, that does not mean, the danger with that is sometimes, oh, well, if they're doing the best that they can, then I need to continue to put up with the pain they're causing me, or I need to let them continue to hurt me. And that's not what I'm suggesting at all. In fact, I think that if we are using generous assumptions, it allows us to have greater boundaries with the person, but also have compassion and understand why they're doing what they're doing. So there's several places I could go, and there's lots of places, obviously, with the Q&A that we could go today. But having a generous assumption is, if I choose not to take this personally, and now it's not easy, if my wound gets hit, if I get activated emotionally, it's terribly difficult to have a generous assumption. My life experience has taught me this pain means I've been abandoned, or this pain means I've been rejected, even though the other person, it's not even in their hemisphere that it's about rejection or abandonment, or that it's about me at all. So making a generous assumption is, one, they're not trying to hurt me, even though they really are hurting me. And what boundaries do I need to put up here to protect myself while also understanding where are they coming from? If I were to stop and make an assumption, they're doing the best that they can, then I can start to see them as the hurt person that they are, and maybe then I'll be able to show up for them. So let me dive into a slide, and just for so everybody knows, I'm going to pull up a slide that I use when I do presentations for couples, and it's going to take me a second to find it, but this is taken pretty much directly from Troy Love's book, Finding Peace. And in his book, Finding Peace, on page 168, he has a, I want to call it a grid. We call it something else, a table. I think it's called a table. And it's taking me forever to find the slide. I happen to have the book right here, and there we go. There's the table, right? And so it's going to be hard to see, and in a second here I'll come up with but he talks about we have attachment wounds and we have corresponding needs. And what we know from attachment wounds is that most of our attachment wounds happened ages 0 to 18. And what I mean by that, even if we don't have any major attachment wounds that occurred, our sensitivity to those particular wounds were developed during that period of time. And so then when we have a partner who betrays us, I'm going to use the word betrays, but let's say we have a partner who cheats on us, then I might be more sensitive to it being a rejection wound. But the same if I had an identical twin and their partner cheats on them, for them it might be abandonment. For another partner, it's betrayal. And all of us have the sensitivity to attachment wounds based on those needs that we didn't get met when we based on those needs that we didn't get met when we were a kid. And so understanding, okay, I finally got this. I'm going to pull it up here. Oh, how do I do? Okay, I'm just going to do this and hopefully it will work. Share screen.
Just click on share screen, and then it'll give you some options of anything that's open on your desktop, and you click whatever it is you want to share.
Okay, I'm gonna shut some, there we go. I apologize, it's taking me so long. I'm like, I want to share this, and then I'm like, but I've never done it, and so you guys are gonna have to suffer while I try and figure this out. Okay, so if you guys can see this, we have these different wounds that come up for us, and so there's a couple of things that need to happen. One of the things we all need to do is learn what wound is this for me, and what's the corresponding need that I have. So if I can learn to do that, I can separate myself from maybe a partner who's causing me pain. And I can learn to reach out to people who are able to show up for me and get my needs met in a healthy way. So as you can see here, if I'm experiencing the wound of loss, what I'm looking for is reassurance. Another word or that we might use is connection. If I'm feeling abandonment, what I'm needing is presence. I need someone to be with me. If I'm experiencing rejection, I need acceptance. Betrayal, I need trust and honesty. Neglect, I need attention, attunement, or to be tended to. And with abuse, I need stability. Another word I use there is nurturing or affection. Now, when our partner wounds us, we also have to try and use generous assumptions not at our expense, but to understand where they're coming from, and that will help us to create better boundaries. So if I can see that they are coming from their wound of rejection, I can honor that. And at the same time, let them know that I have boundaries that I'm needing, and that I can see them and I understand them, and I may not be able to show up for them in their need for acceptance right now. My wound may be too big, but if I have a generous assumption that they are trying to do the best that they can, it allows me to not get caught up in the emotional chaos that often ensues when we go straight to, they are an awful person trying to hurt me. So this very much, I feel like, fits in an understanding the prodependence perspective, that we see each other as people who are trying to make connection and trying to show up for each other, even if we're doing it in ways that are unhealthy. So I think that's all I got for right this second. And now I hit stop share. Am I back?
Yeah, you're back. It worked.
All right. So did that make any sort of sense, Scott?
It did to me. Yeah, I wanted to ask though about generous assumptions. You kind of talked about making them about other people. Should we and can we make generous assumptions about ourselves and our own wounding and our own situations?
Absolutely, right? So understanding, in fact, sometimes I wonder if that's the harder thing for us to do. Most people, it seems like, developing self-compassion, which I would push there and say, making a generous assumption about ourselves really comes down to self-compassion. You know, I was doing the best I knew how. I do need to learn a better way of doing this. So a generous assumption does not mean accepting the behavior as okay. It creates a space for us to work with the behavior rather than getting caught up in the emotional chaos or the emotional unhealthy cycle, if that makes sense.
Yeah, it does. I mean, for me, that's kind of the heart of prodependence versus the codependence model. The codependence model says you're doing it wrong. There's something wrong with you. Prodependence says, you know what, you're doing the best you can. You're a little wounded. Let's take a peek and see how we can maybe do it better.
Yeah, and I always even struggle, like, you know, even when we throw out that you're a little wounded, right? Of course, we all have wounds that we've all had, but that's the thing. One of the things I love about the prodependence model is you are doing the best you can, and I choose to phrase it a little different. You haven't learned otherwise. Where did you learn to respond to this? Nobody has ever been taught how to, hey, you're one day going to marry an addict or be in a relationship with an addict or have a child who's an addict, right? Nobody says, hey, I'm going to train you as a child to know how to respond appropriately to this relationship, right? In fact, I would think it'd be very unhealthy if we taught a child that, right? So as an adult, here I am trying to have a relationship and connect with somebody who's an addict. So learning to have a generous assumption with myself of I'm doing the best that I can. And the truth is, I don't know how to do this. I've never been taught. And so it's going to take me some time to learn how to respond and behave appropriately in this relationship. So yes, I love that. Generous assumptions with ourselves are very necessary.
Yeah. Now you talked about, just because, realizing that yes, he or she is hurting me, but coming from a place of woundedness doesn't mean to hurt me, but it's still hurting me.
Oh, totally.
Yeah, the way to respond is, once we see that, we can set some boundaries. Can you give an example of a situation where you see that and somebody has set a healthy boundary that has helped? Because I think a lot of people get confused about what a boundary is.
Well, I love that you asked that question, and I will always I try to preach understanding what healthy boundaries are all the time, because I think in the beginning of recovery, we almost have to develop this lesser understanding of a boundary, and it's almost like we think boundaries are consequences. So early on in recovery, it's like, okay, so if you do this, then I have permission to do that. So because I come from a sex addiction background, I'll just use that as an example. It's like, if you look at porn, then the consequence is you sleep on the couch. And we think early on, like that's our boundary. And sometimes it is our boundary because we don't really know what we need yet. And maybe even it's like, we think, well, that's what some of the other people in recovery need. And so I don't want to do it wrong. So I'll just do that. A true boundary is very cognizant of our inner need. So if you act out with your addiction, alcohol, drugs, pornography, whatever it might be, I need some space. And in order to get a good night's sleep, I need you, because otherwise having you close, my head's going to be spinning. I'm going to feel, I need some space to be able to relax. So by 9 o'clock, I need you out of the bedroom. And you know, whether you sleep on the couch or you sleep in the guest room or on the floor, that's up to you, right? Wherever you need to go. But what I know is that I need you not here in the bedroom. And I need that so that I can have inner peace, right? And get a good night's sleep and go through my evening ritual and be in a good place. Now, am I punishing you? No, I'm doing that because I know that's what I need. That is a healthy boundary. Learning to separate boundaries from consequences and realize that boundaries are actually vulnerable. If I come to you and I say, and I give you, Scott, I'm trying to come up with something and it just sounds silly at the moment, but if I'm like, hey, Scott, if we're going to keep doing this, I'd like to have a conversation offline so I know your story because I need to feel more connected to you, right? Now I might be asking you, can you show up for me in this way? And you might say to me, you know what, I don't feel comfortable doing that yet. I don't know you. I don't feel comfortable sharing my story, right? You and I are exploring boundaries together based on our needs, and we're being vulnerable with each other. Boundaries are always vulnerable. And so learning how to be vulnerable and reach to somebody else and say, hey, I need you to show up for me here by doing this thing. I might be asking for a boundary because I'm asking for you to be here for me in my need. So, way confusing, or was that clear?
No, I think that's one of the better explanations I've heard. I mean, I always say, you know, my boundaries are about me. They're not about you. I can't control your behavior. If you behave in a certain way, here is what I will do. I will ask you, if you look at porn, I will ask you to not sleep in the bedroom because I need you to not be here. It's about me and protecting myself. You know, boundaries for me are not about keeping other people out. They're about choosing to let you in safely.
Totally.
You know, I think there's a big difference there. And I think a lot of people think, you know, a boundary is a wall, and it's really not. It's a wall with a door in it, you know?
Yeah. Well, and I mean, the way we think of a boundary as a wall. That I actually don't like the word boundaries just because of the way, right? If our country has boundaries, it's like, oh, do not cross, you know, like boundaries unfortunately has this connotation. And so I often tell people, start being less concerned about your boundaries and more concerned about your needs. The problem is, I found for most people, whether they're in recovery or not, whether they are an addict or not, or struggle with addiction or not, most people don't have a clear understanding of their own needs. So trying to ask somebody, hey, don't use the term boundaries, and start discovering what your needs and wants are in a healthy way and share those with other people, I mean, they'd just be lost. So we start out with this really clumsy way early in recovery of like boundaries are like, let me keep you out. And I don't know about you, when I first really learned boundaries, I almost felt like, oh, I have to be mean to people. Oh, I have to be strong and have a voice. And sure, that's part of it, not the mean part, but learning to have a voice is part of it. But I didn't understand boundaries until I got much deeper into my own recovery work, and I went, oh, I have to be vulnerable. I need to be sensitive to my needs. I have to understand what my wants and desires are and see if somebody else can show up. That's really hard.
Yeah, going back to we've got a question in the queue, which I'll get to in a minute. But going back to Troy's graph about the attachment wound and the related need. I mean, I had to go back to what am I feeling? What wound am I feeling? So I could figure out what my needs were around that. I mean, I was so disengaged. I come from the addict side of the equation,
Sure.
not the partner side, but I was just so detached from everything. I
Yes.
had no clue what I was feeling or thinking or needing.
Well, and consider that, like, most people will say, what I need is my pain to go away. Right. And it's like, sorry, that's not a need. In fact, that's not humanly possible. Life, you cannot have joy in life without having pain in life. What we need is some type of comfort or connection. Um, and but when we're early on in recovery, the only thing we tend to be able to identify is the pain. So then we kind of misinterpret what the need is through the lens of pain, right? Because that's all we can see is the pain that's right in front of us.
And is that true not only with addicts, but also with partners usually? Are they usually in the same boat?
I think it's hard because I don't totally want to generalize for everybody, but I think oftentimes, I mean, if you think about it, pain is what shows up as a result of the wound being hit. And so let's say the wound is rejection. All we feel is pain, and we want the pain to go away. So if I'm a partner who feels rejected because of my partner's unhealthy behavior, then I'm just saying, take away the pain. And in my mind, I think, stop doing that. If you would stop doing that, I wouldn't feel pain. And so I think a lot of times that's even a partner is looking through the lens of their pain, trying to identify their needs. So early in recovery, that's why it's so important for partners to develop a solid base of healthier people that they can reach out to, rather than having their partner be their sole source of support, because their partner's so much struggling in their own issues, it's really hard to pull ourselves away from that. Did that answer the question?
I think so. Be confident. Let's go to our Q&A here. I spent years making generous assumptions and recently discovered that my husband was betraying me with many women, basically around the clock. My therapist tells me that my doubts or hesitations about him are good reality testing. I can't help but feel she's right. Doesn't he have to show some pattern of trustworthiness after I've discovered that he has never, ever been trustworthy in all of our many years together?
Oh, that is such a good question. So generous assumptions does not mean that I am not, so I want to use a word, but I hope it doesn't sound shaming. Like, sometimes I found if I have a partner who is living with uh, a husband, let's say in this case, who's betraying you, and if we are seeing the signs that there's problems, and our idea of making generous assumptions is not questioning those signs or checking those signs in, I don't consider that generous assumptions at all. I would say that feels to me, and I would love it if this person responded. Like, I wonder, were you in a place of just like hoping everything was okay, like, and just just, oh well, I'm sure everything's fine, but like you weren't trusting that inner sense that is, I would trust your gut for sure. And so a generous assumption isn't like turning away from the signs. It's when I realize what my partner is doing, like, and I'm not saying that you need to like stay with your partner, but a generous assumption is being able to look at your partner and go, you've been cheating on me around the clock, And my generous assumption here is that you don't know how to live life any different. How sad for you that your attachment wounds are so strong that you need to cheat on somebody around the clock and not know what a healthy, beautiful, connected relationship is. My generous assumption here is that you are so wounded that you don't know how to live life any different. And I don't have to stay in a situation where I'm going to continue to let you hurt me, but I'm not going to make it that I wasn't good enough. I know that I'm doing the best that I can. So this would be the generous assumption about myself, that that I've been a good partner and that I've worked hard and done the best that I know how, and I didn't deserve this. So you are a wounded individual who chose a very unhealthy way of living. And my generous assumption here is that you love me and you just don't even know how to do it. You don't know how to do love. So I hope that makes sense.
Yeah, we did get an addition to that. I attributed the withdrawal, moodiness, etc., as depression, and tried unsuccessfully to get him to get help for that.
Totally.
Yeah.
Right. And I would say that can be a generous assumption to some degree, right? Like, hey, I think it's depression and other mental health stuff, and let's try and get you some help for that. And the truth is, if he has, as you say, been betraying you around the clock, like, he's an expert at it, right? But I would say trust that intuition within you, that you know if he or she, you said husband, if he is, you have an instinct that I would say trust that instinct that tells you something's off, this isn't right. It's not a generous assumption to, if you will, put up with unhealthy behavior. So I hope that makes sense.
Yeah. Um, Michelle Mays, I don't think she invented this term, but she writes about it a lot. She calls it betrayal blindness. It's where you choose not to see what's right there in front of you because the pain of knowing the truth feels far more scary and far more painful than ignoring it or attributing it to something else. And she's very clear that is not a generous assumption. That is fear in action. Now, I'm not saying that's what the situation was here, but she talks about how it's very, very, very common among betrayed partners to kind of look the other way and not know what they know. She calls it not knowing what you know.
Right.
Because knowing is just too scary and too painful.
Oh, totally. Because if I know the truth, I feel like I have to take action, and I'm so lost as to what action would look like. Because again, I wasn't raised to know what to do with this super unhealthy person who is treating me poorly. And so maybe if we just wait a little longer, things will get better. Maybe if we just try this, things will get better. Maybe if we just have sex more, things will get better. Maybe, and those aren't generous assumptions. Those are, like, if you look at Brene Brown's work, she talks about the three things that are needed in order to increase shame. And she says, secrecy is one, silence is another. If we are being silent about the things that we don't know, that we think we know, we're letting shame fester in the relationship. Not that it's our fault. We don't know how to do this. We're doing the best we can. But we let that shame fester. So learning how to see somebody as a damaged and broken individual, but not being silent about it anymore and talking about it as it comes up, that's how you would use generous assumptions to maintain a relationship, even if it's a relationship with a good amount of healthy space.
Yeah, I think there's something important about you take some power back when you take in the truth, and betrayed partners. I'm going to generalize, even though Matt doesn't. They're always worried about what might happen, if this is true, but they have no control over what's going to happen until they take their power back and accept the truth. I mean, from the addict side of things, they always talk about surrender, and people are like, I don't want to surrender, and I'm like, surrender to the truth. So then you can do something with the truth. Instead of, living in denial. You have no power when you're not accepting the truth.
Yeah.
Sort of.
Oh, totally. Well, because if you're, I hate to say it, not accepting the truth, and I have to be so careful here. Like, I want everybody listening to know that it's not like, so I'll give you an example, actually. So in the home I grew up in, my father did all sorts of terrible things, and people used to like say to my mom after it all came out, like, essentially, how did you not know? And it's like, first of all, who believes that their partner, no one wants to believe that their partner is like this awful, like this, I shouldn't say that, this person who is making awful decisions, right? No one wants to believe that, hey, I married somebody, or I'm choosing to be with somebody, or I raised this child, and you know what? They're probably making terrible decisions, right? No one wants to believe that. And yet people would say, well, you had to have known. And so it's, no, when you have somebody who is an expert at deceiving, and people who struggle with addiction, in order to survive, the generous assumption is you became an expert at deceiving people in order to survive in life. That's how wounded you are. So much so that you deceived the people who loved you the most, which is why there's such a betrayal wound there. And so please, everybody listening, don't think that I'm suggesting that it's like, oh, I chose to bury my head in the sand. Of course not. You did everything you could. You fought and like scratched at trying to get to the truth. But there is this place where I think in all of us, I'm so frozen and unsure what to do that I'm just hoping the right thing happens. Sorry, did that?
Yeah, and I just wanted to tack right onto that, which is a comment, and we got another question, which I'll get to in a second, I promise. But the tack on to what we've been talking about, she says she didn't know. He was a fabulous liar, and she had no way to even imagine what was happening. Addicts are master liars, master manipulators, speaking from experience. And we will justify and rationalize and spin you every way we can think of until you don't know which end is up.
Yeah, in an effort to survive, because you don't know, like, in a way, you don't know real attachment because you've had to attach to this addiction in order to find comfort in life. I mean, and it's not even real comfort. It's not even real attachment.
Yeah.
And so it's, anyway, I love how you describe it. So thank you.
Okay. This is another question here. 8 months after my most recent discovery, I assume, of cheating, this is the 4th time in 5 years. My husband and I are struggling to communicate safely. He has always struggled with emotions, recognizing his own and being present with mine. Of course, I'm full of emotions, so he does not.
It sounds like he struggles with addiction.
Yeah.
And there's a lot of people who don't struggle with addiction who also struggle with recognizing their own emotion. We call that emotional tolerance. They struggle with the emotions of others. They struggle with their own emotions. Oh my goodness. That is such an early part of recovery, is just learning to sit in a room with other people and their emotions, and learning to feel their own emotions. They are emotionally stunted, and that's a very kind way of putting it.
Yeah, addictions are the addictions are not about feeling good. They're about feeling nothing.
Oh,
If I'm stressed out or feeling lonely or bored or, anxious or whatever, I will turn to my addiction so that I don't have to feel it, whether it's a drug or a behavior like sex. I want to get out of my head. That's what addictions are. And when you start doing that at 12 or 13, like a lot of addicts, certainly myself, your growth is stunted right there. So let's go on to the rest of this.
totally.
I know a bit about EFT, which is emotionally focused therapy, which Matt is trained in. I love Sue's approach. That's Sue Johnson. Is there a simple place to start with safe communication along the lines of EFTs, hold me tight conversations? You've done your reading. Good. I doubt he will be willing to go through Sue's book in full, but we need to do something different. So thoughts on how they might communicate?
So that's a great question. And let me speak to the Hold Me Tight book. It's phenomenal. I was trained in EFT, and I'll be honest, I had to read the Hold Me Tight book probably 3 times. And I think I listened to it. So maybe that was part of it. But I struggled to understand how the Hold Me Tight conversations and how the Hold Me Tight process actually worked. And so just so you know, the Hold Me Tight book, phenomenal. And I encourage my couples to read it. It's heavy. I mean, it can be hard sometimes. Um, and so I think she wrote the book Love Sense afterwards because it's almost the introduction to Hold Me Tight. It's like the prequel that really probably should have came first, if that makes sense. And so reading Love Sense and just understanding the emotions around our basic attachment needs and how we're wired for attachment. So what I almost would say the it's easier rather than to approach Hold Me Tight conversations as a couple to explore emotions, start exploring emotions with you got to model it because you got to be vulnerable too, but asking him questions like, talk to me about the emotions that come up when you're talking to the guys at 12 step, or talk to me about emotions that come up when that happened with you at work. um, so learning a vocabulary and him being able to use words around his emotions. The other thing that you might even start with, rather than using words, tell me how that felt in your body. Like when you were in group and or you were talking to your friends or you were at work and that person upset you, where did you feel it in your body? So when I have somebody that's really emotionally stunted, I might bring it back and just say, right now, just tell me how it feels in your body. Do you feel it in your chest? Do you feel it in your throat? Do you feel it in your stomach? Do you feel it on your shoulders? We're all a little bit different on where and how and why we feel emotion. Do you feel it in your face, your ears, the back of your neck? Our bodies are like emotional beings, right? And they feel and sense emotion before our brain knows, oh, I'm feeling sad right now. So I mean, if hopefully this answer is helpful, but I want you to try and with yourself, you've got to model that. If he says something that hurts, being able to say, oh, hold on, give me a second, I'm feeling really tight in my chest, and I feel it in my hands right now. Now, if I see that, my first thought is, you're probably feeling anger, right? But if we go straight to even the term, man, I'm feeling really angry, defensiveness goes up, right? So if I can stop and go, hang on, I'm feeling tight in my chest, I feel tightness in my hands, give me a second here. How are you feeling, right? Then right now we're just talking about body sensations. There's not a lot of potentially not a lot of threat there. So that can be a great place to start as a couple or even with our friends, to explore and talk about emotions. Now, if we can move on to, okay, well, what emotion do you think most fits that feeling in your chest? And by the way, what color is that feeling in your chest? And how big is it? And how heavy is it? Right? We want to explore the physiological sensations as much as possible. And that tends to be a safer place for people. And something that people can tune into much quicker than saying, wow, you know what? I'm really feeling sadness and I'm feeling like I'm 13 years old. And it reminds me of that time that I asked Susie if she wanted to go out with me and she told me no, right? Like, which are great conversations and very vulnerable things to have, but that vocabulary and knowledge is way out there. So hopefully that gives you an idea. Physical body sensations, using words that to match to their physical body sensations. And that's probably where I would start, and just having conversations around that, because the Hold Me Tight conversations might be a bit much, but you're certainly welcome to try them and see how they work. I think you're on mute.
Yeah, the hold me tight conversations are, I don't want to call them graduate level sort of couples counseling, but you got to get past some of the initial stuff. I think you're right about the other book should have come first. Um, you got to
Yeah.
get the basics before you move on to the really, and they're incredibly productive and brilliant. But yeah.
Oh, it's exactly where every couple needs to go. But it's like, if we can connect on understanding our physical body sensations, like the tightness in my chest, a pounding in my head, if we can connect there, okay, where else can we connect? Right? Then let's start having conversations about how I'm affecting you and how you're affecting me, and all fantastic. And you definitely want to go there. But if you're dealing with somebody who's as emotionally stunted as you make it sound, I think starting there should work pretty well. And let me know. Come back and tell me how it goes. And if I blew it, I'll be like, oh, sorry, bad advice. Like, let's try this instead.
I'm going to pull something out of our chat feature that came here at the beginning, and I think there's something packed into this statement, and it wasn't meant to be a question, but I'm going to do it anyway, so sorry. For Valentine's Day, I'm getting the silent treatment. I think it's so funny because it's so predictable, LOL. And I saw that earlier, and I was like, wow, that's not funny. That's painful.
It
Um,
is.
I mean, do you see people covering up kind of that pain sometimes? I mean, let's kind of walk it through Troy's chart. Maybe what's the wound and what's the need, and how we're coping.
Well, so um, silence is really painful, I think, for a lot of different reasons. And one of the reasons why I feel like silence is painful is it leaves everything to the imagination. Um, Meaning, it oftentimes we don't know what happened. We don't know why it happened. We don't know, is it us? Is it them? It could just be that it's Valentine's Day, and the person has shame because they realize, oh crud, it's Valentine's Day and I didn't get anything. So I'm just going to go silent and hope that we all forget that it's Valentine's Day, right? There's a million reasons why the person is being silent. But do yourself a favor sometime, watch a video on YouTube. It's called the Still Face Experiment. And the guy's name is Ed Tronick, who talks about it. And it shows these babies where they have a good attachment with their mother, but in the video, the mother is told to have a still face, just totally expressionless, and stare at the baby. So then the baby is like trying to get mom's attention, and the mom has a still face, and you can see the baby is just contorting and like really upset because mom's not responding. And we want nothing more in life than to reach for somebody and have them say, I'm here, it's okay, things are good. So when there's silence, we're reaching and saying, hey, are you there? Or we immediately go, I can't reach to you because you're not there. So silence is such a painful experience in any type of relationship, between between a couple, between parents and a child, between friends. If silence is there, I'm totally guessing and my mind is spinning. And if it's me, my anxiety is like, oh shoot, Scott, what did I do? Please, like, let's figure this out. Like, what happened? Are you okay? Anyway, there's a lot of information.
Yeah, I just wanted to kind of bring that one up because this is one of our regulars, and I kind of know the situation, and it's not funny, you know.
Oh, it's
Speak up. Yeah.
now, if you like, in some way, if you're in a place of if you're in a secure place, well, let me do this. I'll go to another slide if you guys are all right with that. This honestly is probably, this next slide is probably worthy of, we could probably spend the entire time on this, the next webinar, talking about, are you guys familiar? I'm asking the question and only Scott can reply quickly. But are you familiar with attachment styles?
I think probably most people have covered it, but it's, if you want to bring that slide up, it's always a good one.
Yeah, now I just got to find it. Where'd it go?
Okay.
Okay, so attachment styles, you have, most of us have heard of like a secure attachment. Here, I'll bring this up. There it is. It only takes me, well, no, you guys haven't seen it yet. Okay, so if you look here on this, on the attachment styles, you have to consider that this, I don't know, can you see my mouse cursor?
Yeah.
Okay, so imagine this axis right here is what we would refer to as the avoidance axis. So right here would be low avoidance, and right here would be high avoidance. And then this side would be low anxiety, and then high anxiety, right? And if I have low avoidance and low anxiety, I'm comfortable with intimacy, and I'm comfortable with autonomy, and I'm okay and you're okay. So the nice thing about that is if you're not okay, I'm still okay, because I'm in a place of autonomy because you're not wanting to be intimate. And by intimacy, I'm talking emotional intimacy. I don't ever use the word intimacy to talk about sex unless I say sexual intimacy. But if I'm comfortable with autonomy and you're in a bad place and you're giving me the silent treatment, I'm okay. And you know what? I might be sad. I might be hurt, but I'm going to reach out to others. I'll connect with other people, or I can just take some time and you can be silent. And if I want to laugh about it and be like, huh, that's kind of funny. Obviously, something's going on for you. I can laugh about it, but I'll be all right. Obviously that's a great place for us to be. Is in that secure place where you can give me the silent treatment and I'm going to be okay, because obviously you're going through something. So I don't have to run through all the other ones. Hopefully that speaks to that a little bit.
Yeah, and she's responded here. So his silent treatment used to literally drive me crazy, and I was beg and plead for his attention. It was a pattern for years. I realized one day that he was throwing a temper tantrum like a kid holding his breath until they get their way. Now I don't take it seriously and see the situation for what it is. So
Nice. See, that's what I would say. You have done good work and learned to form a more secure attachment where he can throw a temper tantrum, and then that's where you have a generous assumption and go, wow, you are obviously throwing a temper tantrum like a kid. Your kid wounds must be coming up, and so I'm just gonna do my thing, and when you want to re-engage, I'll be here, and we can re-engage when you're ready, and I'll be fine. And it doesn't mean you are dismissing the person. It doesn't mean that you are telling them, it doesn't mean that you're throwing your own little fit, right? So it sounds like you're doing a really good thing, and say, well, you throw your temper tantrum, and whenever you're ready to reconnect, I'll be here.
and I learned something. Yeah, it's okay to kind of.
You learned something?
I did. Yeah.
Do tell.
Well, that answer, I've always thought, and it is for me, it's always a defense mechanism when I decide it's funny. But it could be that I'm okay and you're having a problem, and that's just fine. So
Yeah.
that's what I learned. It's not necessarily a defense mechanism.
Right. If I'm laughing, haha, you stupid child, and I think it's funny, and I'm like making fun of the other person, right? That might be more of a defense mechanism. Or if I'm making fun of the other person in my mind, that might be more of a defense mechanism. But if I'm able to see the humor in a sense and kind of go, well, I feel bad for him and he's throwing a temper tantrum, and I'm like, well, it sucks, but it's humorous and there's nothing I can do about it. That to me feels much more secure. Now, if I'm engaging by laughing and making fun, I'm not in a secure place.
Right. Yeah. There's definitely a difference. So that's what I learned. So thank you
Yeah.
to both of you. Look, we got time for one more question here, and we've got another question in the queue. How do you stop the addiction of looking up your ex online? This person abused me. I know I'm going to feel pain by looking and obsessing about what an a-hole they were to me. I don't understand why I keep doing this after periods of staying off his profile for a few months.
So,
Great question.
oh, it's a fantastic question. So first of all, it's not an addiction. You know, and I think you're probably using just a term there that would, I mean, if you were to use something more clinical, it might be, how do I stop obsessing by looking at the person online? But the reality of it is, a lot of times we refer to, I mean, there's a couple of terms, and I would explore these with your therapist. Something that it could be that I often explore is, has there been some type of trauma bonding that's occurred where, as a result of the trauma and this person being terrible to me, that I still feel some type of bond there where, and that may sound a little scary because I'm not saying that you like the person, but you still feel some need to have even a very distant connection by looking up their profile. And so I would work through and see, is there something that I'm struggling to let go of? Am I hoping that things go bad in their life, so I keep looking at their profile hoping that that karma caught up to them, right? You're going to need to explore a lot of what that underlying desire is. Is it me wondering if they found somebody better than me? I mean, there's a 1,000 different reasons or more why somebody might keep going back to that pain. The other thing that it could be is trauma repetition, right? I don't know how to clear the pain in my body. And so I've developed this pattern of bringing up the pain over and over, either by finding somebody else to hurt me or going back to this profile and reimagining the pain that they put me through. And so I go through this pattern of trauma repetition as a way to try and clear my mind and finally be done with it. The problem is it doesn't work. So we develop, that's why it's called repetition. And so we kind of take ourselves back through that repetition, hoping that it clears the amygdala in the brain and we're good. And so sometimes, and it depends on the client, I will do what's referred to as like a psychodrama around the trauma to see if we can rewrite that story. EMDR is a great way to do this as well. Let's rewrite the trauma and see if we can clear that pain, if it is in fact trauma repetition. So those are two things that I would explore with a therapist and start to understand what's going on underneath. I don't think it's an addiction. And I struggle to even call it an obsession, but because I think mostly it's trauma for you that you're trying to figure out how to work past, and you feel embarrassed. And I would tell you, don't feel embarrassed. Your body and your brain are just trying to do whatever they can to get rid of the trauma. I think you're doing the best that you can. And you might notice patterns that you stay off the profile and then you have a particularly stressful time, or your wound is getting hit that maybe you don't feel like you're good enough, and that reminds you of how much they made you feel like you weren't good enough, and so you're revisiting it for that reason, right? There's so many places to go, which is a great reason for you to find a good therapist that can help you explore some of these things.
Yeah, it's a super complicated question and topic that, yeah, maybe at some point we can do like an educational bit on trauma bonding and repetition, just to help people really understand the depth of it and how to deal with it. That might be a good topic for one of these.
Yeah, sure. I mean, I've tended to try and figure out how we could, make this webinar mostly about couples, and trauma bonding and trauma repetition happens in couples. So, I mean, we certainly can, I just hadn't even thought of that. But certainly if you guys think that would be something you want to hear, we can talk more about it.
Yeah. Thank you, Matt. Thank you, everybody, for being here. We're out of time. Matt will be back in 2 weeks, which will be the 28th. He's here every second and fourth week. The first and third week is Kim Buck, same time. And Kim work together.
Kim is freaking awesome. You should show up and give Kim some good questions, right? And so
yeah, give her some really hard ones.
I wasn't gonna say that, but I mean, if you got hard questions, Kim and I will take it. Whatever you got, we're excited to help. So thank you guys for trusting me and letting me show up for you in this way.
Thank you, everybody. We'll see you in 2 weeks, and hopefully you'll see Kim and Tammy next week. So
Awesome.
well, see you, Matt.
See you, brother.